Snapshot. This article reviews the anatomy, diagnosis, and treatment algorithm for turf toe injury, a hyperextension injury to the hallux metatarsophalangeal (MTP) joint, to provide clinicians, therapists, and athletic trainers with useful information. Key findings. Turf toe injury is a spectrum of injuries ranging from a sprain of the plantar structures to frank dorsal dislocation of the joint with complete disruption of the plantar structures. The injury can be subtle, and a high index of suspicion is necessary for proper diagnosis. Grade 1 injury is a stretch of the plantar capsular ligamentous complex. Grade 2 is a partial rupture, and Grade 3 is a complete rupture. The decision to proceed with operative repair is based on specific criteria. Surgical repair aims to restore normal, stable anatomy of the hallux MTP joint. Post-operative rehabilitation involves a toe spica splint, gentle passive range of motion exercise, and protected weight bearing. Objectives. The objective of this article is to provide clinicians, therapists, and athletic trainers with useful information on the anatomy, diagnosis, and treatment algorithm for turf toe injury. Methods. A literature search was performed by reviewing PubMed and Ovid articles published from 1976 to July 2010. Non-operative management involves low-impact exercises, toe protection, and shoe wear adjustments. Operative repair involves a dual incision technique, primary repair of soft tissue structures, and possible sesamoidectomy. Results. The results of the literature search showed that turf toe injury can be classified into 3 grades. Grade 1, a sprain or attenuation of the plantar capsular ligamentous complex of the hallux MTP joint. Grade 2, a partial rupture of the plantar soft tissue structures of the hallux MTP joint. And Grade 3, a complete rupture of the plantar structures of the hallux MTP joint. Athletes may take 2 to 8 weeks to return to play, depending on the grade of injury. Post-operative rehabilitation may take up to 6 months for complete resolution of symptoms. Studies have reported varying outcomes, including joint stiffness, pain, and decreased dorsiflexion. Conclusions. With accurate diagnosis, athletes can have an appropriate treatment plan, and their expectations can be tempered to the degree of injury. Careful management may allow successful return to play at a pre-injury level of participation. Careful management of turf toe injuries is necessary to allow successful return to play at the pre-injury level of participation. Future work. The article does not suggest any future work or directions for further research. Further research is needed to improve understanding and management of turf toe injuries. Practical applications. The article provides practical information on the diagnosis and treatment of turf toe injury, which can be useful for clinicians, therapists, and athletic trainers. Athletes and healthcare professionals should be aware of the importance of proper diagnosis, treatment, and rehabilitation of turf toe injuries to prevent long-term consequences. Limitations. Confusion still exists regarding the anatomy, mechanism, diagnosis, and treatment of turf toe injuries.